So this is from Dr.Abdul Hafeel in Dubai, whom, as I said, is from Kerala, from an Ayurvedic family, a dear friend to some of us. He's a young Ayurvedic doctor of about 30 years of age, but a very, very experienced one because of his training at Ayurveda Shala Chikitsalaya and of his family background. What he's saying is that he's giving some history of the UAE, that it comes from a colonial background and has formed into a kingdom of 3 different major states, or 6 major states, I beg your pardon, with a population of 3.7 million. And this is striking. 80% of that population is made up of people not from the UAE, of expatriates, most of whom are Indian. So this is important to know. UAE does have strong links with India and is very advanced in having an integrated model of traditional, complementary and alternative medicine, that's the TCAM, into national health care. The ministry has struggled with doing this integration and had for many years, as Dr. Hafeel points out, really tried to ignore this complementary field, wish it would go away. He notes that there are challenges in integration, which are the lack of understanding of the principles of complementary therapies, the lack of interest by senior and conservative members of the Ministry of Health, the resistance to change among orthodox practitioners, and difficulties in understanding and accrediting the CAM practitioners, again, who have limited training. So a consistent presentation of issues across countries here. He's got the milestones in integration there, and you can see in 2002 there was an amendment to the medicine practice degree to include traditional Indian medicine, Ayurveda, as well as many other approaches. So Ayurveda has been official in Dubai and the United Arab Emirates for 4 years now. He talks about the decisive factors in the successful integration of Ayurveda in the United Arab Emirates. For a start, there's this demographic factor, the cosmopolitan dimension of the society, the establishment of a complementary medicine unit in the Ministry of Health, attitudes changing in terms of a free economic policy, and that's an interesting point. Support and partnership from the World Health Organization. That's, again, a point we've been drilling away at in this session. A series of international WHO-supported conferences, some of which I've attended in the United Arab Emirates, and WHO's had a strong role in these conferences funded by the United Arab Emirates. WHO will put their name on it, but the UAE, just as with China, funded the meetings. Media campaigns, and also people who have come to India and benefited go back to the United Arab Emirates and want to start a clinic or want to bring doctors over. Some of you perhaps as Ayurvedic doctors have already been as part of this exchange to the UAE. So he's got a list of regulation and practice categories, and you can see the licensing categories. There's a traditional medicine healer, an assistant practitioner, a junior practitioner, a practitioner and therapist, specialist practitioner, consultant practitioner. So the UAE has really actually gone quite a long way here. They've developed categories of expertise that are independent of any particular type of complementary medicine. They've said this applies across the board to everyone, different levels of status. And they've got categories for medical practices as well, for people's businesses in complementary medicine, an independent practice, an under clinic license, under the supervision of a licensed practitioner, and a hospital-based practice. He's got categories of education here, and you can see in the level of experience category there, it requires between 5 and 1 year of training there to complete the different courses. So a full range of training options and requirements. The United Arab Emirates in 4 years has come a very long way to an articulated framework. He gives examples of different types of practitioners and therapists, which you can see there. Basic for massage, and this might be a useful reference for Europe and other places that are struggling with this issue of do we do 5.5 years or do we allow a 6-week training course. UAE allows everything but assigns different levels of professional certification to different types of training background. Here we have his graph of practitioners of traditional, complementary and alternative medicine, and the red bar is applicants who attended exams, and the white bar is the number of people who passed those exams. So what you can see is in 2002, a lot of people attended and still not a lot passed. But in 2003, the standards got tighter and the number passing dropped a lot, from 218 applying to 30 passing, compared with 311 applying and 104 passing before. So UAE tightened the standards, and then as you can see, the numbers passing started to go up. 2006 obviously is small because it's not complete data. But what he's saying is that a lot fewer people pass these exams than apply for them, which speaks well for the high standards of the UAE, that they're requiring good training. I'm not going to go through all of these because I've been told that we are short of time, but he does point out that in terms of the TCAM sector, the Ayurvedic practitioner stands second in terms of most available in the community. I'm not sure what the first is. All the licensed practitioners are graduates of Ayurvedic colleges in India. No Ayurveda practice exists in the government sector except in the Dubai Herbal Center, which is personally supported by the Sultan of Dubai. Interestingly, almost all of the major hospitals in the United Arab Emirates have a complementary medicine branch which includes Ayurveda. So they're already integrating, it's quite advanced. And there are exclusive Ayurvedic clinics, but only a few of them due to regulations. But he also points out what Mark Rosenberg was mentioning in Germany. There's this two-track approach. One is the medical, clinical approach to Ayurveda, and the other is the spas and hotels offering wellness and rejuvenation and beauty programs. Same trend. He's saying that this beauty trend and the massage to make quick money has been a negative influence on Ayurveda. He also notes that Ayurveda is expensive for serious users. He points to the lack of standards of medical products and that the local people are concerned about this. He also says that regulation of herbal medicines is insensitive to the specific production characteristics of Ayurvedic medicine. He also notes a lack of quality control and research and education and platform for interaction. Let me see how many. There's a lot there. I think I'm going to jump through. Basically, he says that there is an emerging trend in organization, training, and safety issues, but it's still in an early stage. There's not much funding available across the board at all for complementary medicine research, so there's no research in Ayurveda at the moment. In conclusion, he says that UAE is one of the first countries in the region to effectively integrate traditional medicine, opening the doors for quality practice. He says there is a downward trend for Ayurveda because of the incomplete policy on Ayurvedic medicine, the lack of representation in the policy sector on behalf of Ayurveda. Mother India, we're calling you again, from the United Arab Emirates. Thank you very much.